Hello. If you're here, there's a good chance you've just heard a pretty big, complicated sounding diagnosis for your child: crossed fused renal ectopia. And I get it. Hearing a term like that, it can be a lot. It can be really overwhelming. But that's exactly why we're here. We're going to break this down piece by piece so it's clear, simple, and hopefully a lot less scary. Okay, so here's our game plan for this explainer. We'll start with what this condition actually is in simple terms. Then we'll peek into how it happens before birth, how it's diagnosed, what it really means for your child's health, and we'll wrap up with the care plan and the long-term outlook, which is really positive. All right, first things first, let's tackle that name: crossed fused renal ectopia. What in the world does that actually mean? I promise you it's way simpler than it sounds. So right off the bat, let's get to the most important thing you need to hear. This is a congenital condition, which just means your child was born this way. But here's the absolute key. This is all about the positioning of the kidneys. It's a difference in where they are, not a disease that makes them sick. Think of it as just an anatomical variation, where both kidneys ended up on the same team, on the same side of the body. Let's really visualize this. There are three main things going on. First, as you see here, both kidneys are hanging out on one side of the spine. Second, they're usually fused, kind of joined at the hip. And third, and this part is pretty amazing, the little tube that drains urine from the kidney that crossed over, it actually travels all the way back across the body to plug into the bladder on its correct original side. The body is incredible, isn't it? So you might be wondering, how does this even happen? Well, to understand that, we need to go back in time, way back, to see the incredible journey the kidneys take before a baby is even born. It's pretty fascinating, actually. Super early in pregnancy, around week 4, the kidneys start out way down low in the pelvis. Then, over the next month or so, they begin this big journey, moving up and rotating until they settle into their final spots, usually on opposite sides of the spine by about week 9. It's quite the migration. And that's it. That's the whole story. Cross-fused renal ectopia happens when there's just a little detour during that upward journey. It's a developmental blip, a random event, and what's so important for you to know is that it's absolutely not caused by anything anyone did or didn't do. Okay, so how do doctors actually figure this out and get a good look at this unique anatomy? And maybe more importantly, why do they need to see the whole picture? A lot of times, the first clue pops up during a routine ultrasound while you're still pregnant. The technician might just notice, hey, I only see one kidney where there should be 2. Then, after your baby is born, another ultrasound will confirm it. Sometimes doctors might want more detailed images to create a full roadmap of the whole urinary system and to check on the neighboring organs. But why all the detailed pictures? Why is getting that full comprehensive evaluation so critical? Well, let's look at a real-world case study because this really makes it click why doctors are so thorough. So in this one particular case with a baby girl, when they did the imaging, they saw the crossed-fused kidney, for sure. But they also found a few other things. There was something called reflux. That's where urine can kind of flow backward. Her uterus had a slightly different shape. And there was this tiny connection that wasn't supposed to be there. And, this is the perfect reason why doctors look at everything. They need to see the whole picture, right? So they can build the absolute best care plan for your little one. All right, let's get to the question that's probably been on your mind this whole time. What does this all mean for your child's actual day-to-day health? This is it, the big question for every parent. And I want to start the answer with something really, really reassuring. Just let that sink in for a second. Many people with this condition have 0 symptoms, none. It's actually not that uncommon for someone to live their entire life and never even know they have it, until it's found by accident for some other reason. For a lot of people, it's completely silent. Now, because the plumbing is a little different, your child's doctors will just want to keep an eye on a few things. The unique setup can sometimes make it a bit easier to get urinary tract infections, or UTIs. It can also be linked to that backward urine flow we mentioned, VUR, or a higher chance of kidney stones down the road. But the key word here is monitor. Being aware and proactive is the name of the game. And that leads us perfectly into our final and honestly most important section. What's the plan? What does the path forward look like for your child? This is so crucial to understand. The management plan isn't about trying to fix the kidney's location. It's not about that at all. It's all about proactive care, just keeping an eye on kidney function over time, and if a complication like a UTI does pop up, treating it right away. And here it is. This is probably the most powerful and relieving thing to hear. Surgery to move or separate the kidney is almost never needed. It's just not necessary. Any surgery would be to address a specific complication, not the kidney's position itself. For the vast, vast majority of kids, it's all about wellness and checkups. So, let's bring it all home. While that diagnosis sounds huge and complicated, the reality for your child is usually very straightforward. This is a manageable condition. You have a team of doctors and nurses who are ready to be your partners in this, to monitor your child's health and to help them live a full, happy, and healthy life. The journey forward starts with understanding, and I really hope this has been a helpful first step for you.